Hey guys, it's drug test drug exam number 17. There's only 18 of them. That's good. We're getting closer. So this week we're going to talk about the second half of the RSI medications that we will be dealing with. There are just four again this week, and we're going to start off with propofol. Propofol is a sedative. It's interesting in the fact that it is not a push dose. It is a medication infusion. It's a drip. And basically, the duration of its action is as long as you have the drip going, you are having the patient be sedated. It's kind of you turn the drip on, give this specific dose, and they become sedated very quickly. And when you stop that infusion dose, they become awake very quickly. The other name for propofol is Diprivan. In this situation, our dosage for propofol is to contact medical control for the appropriate dosage. One thing we want to remember with propofol is that we don't want to give it to a hypotensive patient because it will just exacerbate that hypotension and make that worse. So we have to be really careful with it. It's the nice thing is that turning that drip on causes sedation. As soon as you turn that drip off, the sedation starts to go away. So it's really interesting in that. And in fact, little known fact that Michael Jackson, his doctor was giving him propofol to help him sleep when he was overdosed and ultimately died from that. So it's kind of gotten a bad reputation since the death of Michael Jackson. The next medication we're going to talk about is rocuronium. Rocuronium is a non-depolarizing neuromuscular blocker, meaning that it is a paralytic. And it is, the other name for it is Zimmeron. And it is used typically in RSI. It would be used in conjunction with some type of sedative, whether it be Versed or one of the sedatives that we've talked about, propofol, for example. Just depends on what your agency carries. The dose for it is typically zero point 0.6 to 1.2 milligrams per kilogram, and it has a pretty quick onset of about 30 to 60 seconds, and the duration is pretty long. It's from 30 to 60 minutes. So once you administer it, the patient's going to be paralyzed for quite some time. It can cause bronchospasms sometimes. You'll see that as well. Next medication we're going to talk about is succinylcholine. Succinylcholine is a little bit different of a neuromuscular blocking agent in the paralytic, and the fact that it is depolarizing. And remember that when we polarize, or excuse me, when we depolarize something, it's like the heart, when the heart beats, it's being depolarized cells, the cell wise. So you can see fasciculations or little tremors or little tweaks or little flinches sometimes when you give someone succinylcholine because those neurons are firing into the through that junction, and so you can sometimes see the fasciculations with giving it. So the other paralytics, the rocuronium, the vecuronium, the pancuronium, those are non-depolarizing um, neuroblocking agents, but succinylcholine is the one that is depolarizing. It can cause hyperkalemia, so we have to be careful with it. It also can cause an increase in intraocular pressure. So people that have glaucoma, they have a potential eye injury, all those types of things, multi-system trauma, we have to be very careful because those underlying conditions can cause hyperkalemia themselves. And then if we give them succinylcholine, we're going to make that calcium level go way up. So we have to be really careful with that. So keep that in mind. The dose for it is 1 to 1.5 milligrams per kilogram. The next medication we're going to talk about is vecuronium. And vecuronium is another non-depolarizing neuromuscular blocker. It is also known as Norcreon, that word right there, yeah. It is like I said, a non-depolarizing neuromuscular blocker, and we use it in RSI for as a paralytic. The adult dose is 0.08 to 1.0 milligram per kilogram. And that is the maintenance dose. So there's an initial dose that you would push, but for this drug exam, the drug exam dosage that we're looking for is the maintenance dose. It is the medication that you would give them repeatedly over a set of time to keep that neuro blocking the paralytic going. So remember, for this exam, it is 0.08 to 0.1 milligrams per kilogram. And it can have a very long duration of 45 to 90 minutes. So this video was pretty short this week. If you have any questions, give me a holler, and we will see you in cardiology.